Hello everyone, Drew Watts here with Restorative Oxygen Care, and I'm back with our Medical Director, Dr. James Collier.
Hello.
For the next installment in our cancer video series. And rates of cancer in the state of Kentucky are extremely high, and we have some of the highest cancer rates in the United States. And we're specifically going to talk today about cancers involving the pelvis. So that might be colorectal, cervical, and others, and how those cancers are often treated, and how some of those cancers and those treatments present themselves in our facility.
Okay.
So explain a little bit about some of those cancers and how radiation may be used to treat them.
Okay. Bladder cancer, prostate cancer, some of the female genital tract cancers are often treated with radiation, either internally placed radiation seeds or externally delivered radiation beams. But those can leave scarring injuries or chronic inflammatory injuries that can last for months after delivery of the care episode. And that's what we're mostly involved in, is trying to help get those long-term complications calmed down or eradicated. And hyperbaric is particularly effective for certain of these. The linings of the colon, of the entire gastrointestinal tract, and of the bladder are particularly vulnerable to this because they are such active areas. The surfaces are continuously being recreated. But once the process of recreation has been damaged by radiation, it's hard for them to get settled down to a normal, steady state. Therefore, people will continue to have long-term consequences such as bleeding from the rectum or from the bladder. Most people are alarmed when they see blood in the toilet. But sometimes just irritation in the bladder area, seeming to have infections all the time, can in fact be the result of damaged bladder tissue, or chronic annoying diarrhea or pain in the rectal area can be from scars left from radiation treatment. Both of those are highly effectively treated with hyperbaric oxygen.
Okay, and so one of the things that, when we're going around and speaking with specifically gastroenterology offices is radiation proctitis and colitis.
Right.
So can you tell us a little bit about what that means?
Okay.
What do those words mean?
That just basically means these tissues are really irritable. So it is difficult, for instance, to form a normal stool. The stool just keeps passing through as kind of a watery mess. Or it can contain blood, or that the bladder is hyperactive and people have to urinate with significantly more frequency than they did before their cancer therapy. These are symptoms that can represent ongoing, unresolved post-radiation syndromes.
Okay. And so again, you listed some of those symptoms that patients might actually see. Kind of give us the top 3-4 things from a proctitis side.
First and foremost is blood in the toilet. And obviously most people think that that's abnormal and actually feel like something should be done to explain or resolve that. Things that might be less obnoxious to people are just having to use the toilet more frequently, urinate too much, move bowels too often. These things can just be signs of chronic irritation that has not resolved after the radiation event.
Okay. And a lot of those wounds that you're discussing, you can't see with the naked eye, right?
Nope.
They have to use some sort of tool.
Yes.
What about some of the wounds that might manifest that are visible, that are essentially outside the body?
Okay. These are unlikely to be caused by radiation. certainly can, but as a rule, radiation does not cause breakdown into open wounds. You can have chronic skin burn, for instance. Even that's relatively rare. But any kind of wound healing, unfortunately, diabetes is extremely common in Kentucky, so it's very common to find cancer treatment and diabetes care going on simultaneously. And diabetics have greater difficulty healing anything than people who do not have diabetes.
Okay. And then what about some of those chronic inflammatory markers? I know we talk about that a lot in the digestive tract, right?
Right.
HBOT can certainly help with those chronic inflammation markers as well.
We're finding that to be increasingly relevant, that colitis of any cause, not just radiation, is probably going to respond to HBO. That's an ongoing area of research interest.
Wonderful. If you think that any of this information may be relevant to you or someone that you know, please feel free to reach out to our office. The information is listed at the bottom of the screen. We would be happy to answer any questions you may have and help coordinate care or a referral with your referring provider. Dr. Collier, thanks again so much, and we'll see you on the next installment of our Cancer Series videos.
All right.